Diabetes alternative treatments. What are alternative treatments for diabetes? Maintaining blood sugar levels is part of managing diabetes. Doctors often prescribe traditional treatments, like insulin injections to keep blood sugar levels normal. Some people with diabetes also use complementary and alternative therapies, CAM. These therapies aim to treat the body and the mind. Alternative treatments for diabetes include herbs, supplements, diet, exercise, relaxation techniques. There is little evidence whether some CAM therapies work. Supplements may be considered all-natural. But that doesn't mean they won't interfere with traditional medications. In fact, there's no legal definition of all-natural. Diet and exercise. Most of us don't think of diet and exercise as alternative medicine. But they do fall under this category. Diet and exercise are important in treating diabetes. What you eat and how active you are impacts your blood sugar level and health. Having a healthy diet and staying active have a positive impact on diabetes. Having an exercise regimen is a standard recommendation for people with diabetes. The American Diabetes Association, ADA, recommends doing resistance exercises twice per week for people without activity restrictions. Examples could be lifting free weights or using resistance bands. Those with type 2 diabetes should also aim for at least 150 minutes of moderate to intense aerobic activity every week. The World Journal of Diabetes published a review of studies about type 2 diabetes and exercise. The review found physical activity is one of the best treatments to control type 2 diabetes. Exercise can reduce blood pressure, improve the glucose tolerance, and reduce too high blood sugar levels. The ADA makes the same recommendations for those with type 1 diabetes. But people with type 1 diabetes should be careful. They are more at risk for hypoglycemic episodes during exercise. They should watch their blood sugar levels carefully. Herbs and supplements. Herbs and supplements are popular CAM therapies for people with diabetes. But the U.S. Food and Drug Administration, FDA, doesn't consider these therapies medicines. They aren't regulated. There are also no definitive studies that support treating diabetes with supplements. Most support for these substances comes by word of mouth. Always speak with your doctor before you start taking any new supplements. Some supplements can interact with medications you're taking. Some of the most popular supplements used for diabetes include aloe vera. In 2 clinical trials, researchers found participants who took aloe vera for 6 weeks had lowered fasting blood sugar. The trials included long-term use of aloe vera. But there is concern about the impact of aloe vera taken orally, including its laxative effect. Alpha-lipoic acid, spinach, broccoli, potatoes. All might reduce nerve damage related to diabetes, diabetic neuropathy. Some studies support the use of this supplement for neuropathy. There is some evidence ALA has benefits when taken intravenously. Several studies show it's not effective when taken by mouth. There is little support it protects against diabetic macular edema or improves the body's response to insulin, according to the National Center for Complementary and Integrative Health, NCI. Chromium. People with diabetes lose more chromium in their urine than the general population. This may affect insulin resistance. One study found people taking a type of oral diabetes medication experienced improved control of blood sugar levels when they also took chromium supplements. Cinnamon. Studies on cinnamon show inconsistent results. According to the Mayo Clinic, some studies show cinnamon can enhance insulin sensitivity. Other studies have found no effects. If cinnamon is helpful, its benefits are minimal. Garlic. Garlic, Allium sativum, is a popular supplement. But research on its effects in people with diabetes is minimal. Clinical trials in people with type 2 diabetes who took garlic didn't show changes in blood sugar or insulin levels. Some clinical trials found garlic lowered total cholesterol levels and blood pressure levels. Ginseng. Ginseng is a powerful herbal supplement. It interacts with several medications, particularly warfarin. This is a medication doctors prescribe as a blood thinner. According to NTSA, no current research supports taking ginseng. Gymnema sylvester, Gymnema. This Ayurvedic treatment involves chewing the leaves of the Gymnema plant. The Hindi name for the plant is gurmur or sugar destroyer. The plant may have blood sugar lowering effects, but clinical studies have yet to show its effectiveness. Magnesium. This mineral is present in many foods, including whole grains, nuts, green, leafy vegetables. A 2011 meta-analysis of diabetes research related to magnesium found people with low magnesium levels were more likely to develop diabetes. Eating a diet rich in magnesium provides healthy foods and is risk-free. But taking supplements is not recommended until clinical studies can prove its effectiveness. Omega-3 fatty acids. Omega-3 fatty acids are considered good fats. They're found in foods like salmon, walnuts, soybeans. Supplements may help reduce heart disease and triglyceride levels, but there's no evidence they reduce diabetes risk or help people manage diabetes. Also, the supplements can interact with medications used to thin the blood. Polyphenols. Polyphenols are antioxidants found in fruits, vegetables, and whole grains. Evidence on the effectiveness of a high polyphenol diet has not produced conclusive findings. Prickly pear cactus. Also known as nopal, prickly pear cactus is a plant used in cooking. It may also have medicinal effects, but there's no known link between taking nopal and treatment for diabetes. Vanadium. A few studies show that in very high doses, vanadium may increase a person's sensitivity to insulin. Evidence is not yet conclusive. Vanadium can cause side effects in high doses. It can also be toxic at very high doses.